Welcome to NurseEdScholar. Today we will be exploring hypermagnesemia, covering its causes, assessment, and nursing interventions. Hypermagnesemia occurs when the serum magnesium level exceeds 2.6 milliequivalents per liter. This video explores the causes, assessment findings, and nursing interventions for managing this condition. There are two primary causes of hypermagnesemia. The first is increased magnesium intake, which can occur when a patient uses magnesium-containing antacids or laxatives, or from excessive intravenous administration of magnesium. The second cause of hypermagnesemia is a decrease in renal excretion of magnesium. This is often due to renal insufficiency, where the kidneys cannot excrete magnesium efficiently, leading to elevated levels in the blood. Now, let's move to assessing a patient with hypermagnesemia. When evaluating the cardiovascular system, you'll look for bradycardia, which is a slow heart rate, and dysrhythmias, or abnormal heart rhythms. In severe cases, hypermagnesemia can lead to cardiac arrest. You may also observe hypotension, which is low blood pressure. When assessing the respiratory system, evaluating for insufficiency is important. This can occur if the skeletal muscles that control breathing are affected by magnesium toxicity, leading to weakened respiratory muscles. When assessing the neuromuscular system, deep tendon reflexes may be diminished or absent. Patients will often experience skeletal muscle weakness. For the central nervous system, patients may exhibit drowsiness and lethargy, which can progress to coma if left untreated. To confirm hypermagnesemia, laboratory results will show a serum magnesium level that exceeds 2.6 milliequivalents per liter. On an EKG, you may notice prolonged PR intervals and widened QRS complexes, both of which indicate changes in the heart's electrical conduction. As a nurse, there are several interventions you will perform for a patient with hypermagnesemia. First, you may administer diuretics to promote the renal excretion of magnesium. Second, you may administer intravenous calcium chloride or calcium gluconate to reverse the effects of magnesium on the heart. Remember, calcium gluconate is the antidote for magnesium overdose. Another key intervention is educating the patient about dietary modifications. You will instruct them to restrict foods high in magnesium, such as dark green leafy vegetables, fruits like bananas, dried apricots, and avocados, nuts such as almonds and cashews, peas and beans, soy products like tofu and soy flour, and whole grains like brown rice and milk. Lastly, you will advise the patient to avoid using laxatives and antacids that contain magnesium, as these can worsen hypermagnesemia. Ensuring the patient understands the need to avoid these products will help prevent future episodes of elevated magnesium levels. In summary, hypermagnesemia is when serum magnesium levels exceed 2.6 milliequivalents per liter. The primary causes are increased magnesium intake and decreased renal excretion. Key assessment findings include bradycardia, respiratory insufficiency, muscle weakness, and changes in EKG patterns. Nursing interventions promote magnesium excretion. They administer calcium gluconate as an antidote, restrict magnesium-rich foods, and advise patients to avoid magnesium-containing products. Thank you for watching NurseEdScholar. If you enjoy this content, please subscribe for weekly nursing videos, and share with your fellow nursing peers.